My name is Duane Reynolds, and I'm the founder and CEO of Just Health Collective, and we are a consulting and advisory services firm and digital engagement community, and we help healthcare organizations accelerate health equity and belonging. As a champion of this work, I'm really excited to see the amount of fervor to advance diversity, equity, and inclusion. DEI is really quite expansive and has impact on almost all aspects of business. However, there's an urgent need to remove structural disparities within our health industry. It's not only the right thing to do, but in fact, it's a key solution to driving costs down and saving lives. Employers are taking a stand against health inequities that have deeply ingrained traditional health benefit structures. By making essential and innovative changes to health plan design, employers are addressing cost barriers and putting inclusivity at the top of their priority list. Today, you're going to hear from leaders who are building more equitable health plan designs for all. And now I'd like to introduce our panelists. First is Sarah Chavarria, who is the Executive Vice President and Chief People Officer of Delta Dental of California and its enterprise affiliates, including Delta Dental Insurance Company, Delta Dental of New York, and Delta Dental of Pennsylvania, which operates in 15 states. Next, Dr. Ian Tong, who's the Chief Medical Officer at Included Health Organization. Next, we have Christopher Kim, who is the Global Head of Benefits, Wellness, and Employee Experience at KKR, an alternative asset firm. And finally, we have Lindsay, Jurist-Rosner, who's the CEO of Wealthy Incorporated, based in New York City. Wealthy is a caregiving concierge service helping 66 million Americans who care for aging, chronically ill, and disabled loved ones. So thank you to each of you for joining us today. We're excited to have you. All right, so let's jump into the questions here. So my first question is related to our current state. The pandemic, social unrest, and economic challenges have really changed the nature of how we work and what employees expect from employers. My first question to the panel is, how has the pandemic impacted expectations for work and benefits? And Sarah, why don't we start with you?
Sure, happy to start, and thank you all for joining. I mean, it has been an incredible journey with the pandemic. I'd like to remind people that we didn't just have a pandemic, we also had an incredible period of social injustice really coming to the forefront. And I think for a lot of organizations, it really changed and accelerated the conversations we were having about diversity, inclusion, and belonging, and really gave us an opportunity to connect with our employees in ways that we haven't connected before. And so coming into the pandemic, kind of March 16th for us, really begged an invitation to think about, first and foremost, what our employees needed from us at that time, which was security, safety. We thought about things like emergency time off. You know, how are we going to enable folks to get the testing done? And how do we empathize with everything that they're going through? And then layer in the invitation as an employer to take a stand as an organization and stand with our employees who, like many of you, sit in communities across the country where the conversations that they were having at dinner were real. And so as an employer, then we had the opportunity to really stand with our employees and enable lots of opportunities for them to engage in their communities and vote and do all of those important things that they needed to do. And so I think, you know, the last 18 months or so has been, I'll just use the word invitation again. It's been an incredible time to connect with the individual needs of our employees, connect with where they're coming from, who they are, what they stand for, and create space for us as an employer to share in that understanding by listening to them, engaging with them, and and making what we can available. And that gets us to part of the conversation today, which is also through benefits. So, thinking about their engagement and what matters to them at work, and benefits plays a role in that.
Yeah, thank you, Sarah. As we think about this great resignation that is happening, it really is about employee well-being and people feeling valued and respected. And so benefits certainly play a role in that overall picture. Chris, maybe you can comment a little bit from your perspective.
Sure, and I think I just echo a lot of what Sarah said. I think with this great resignation, there's been sort of this great reevaluation, right? I think people are sitting down with their families, with themselves, really thinking about, okay, what matters to me at this point? And I think it's cut across all the different major dimensions of the workplace experience, whether it's literally, where's my office located? What commute do I have? How much work-life flexibility? How much autonomy do I have? Is this all worth it, right? And am I worth it? And does my company value me and think that I'm worth what I'm putting in? And I think that's really been, indicative of just this shift where I think for many employees, the office has been sort of the center of their lives. And I think there's a bit of a recalibration there where I think people's homes and families has come more front and center. And I think as part of that, employers and I think benefit leaders have to really sit down and reevaluate their listening strategy and really make sure that they're going beyond healthcare claims data. They're going beyond benefit utilization. Those things are always going to be important, but I think we need to reconnect with other parts of the HR organization and think about engagement surveys and how do we really make sure that we're understanding and assessing where people are struggling, where they need help and support, and how can our benefit programs and policies help in that very effort. So I think that's certainly been a part of how we've been thinking about it. And I think a lot of people have been surveying their folks repeatedly throughout the pandemic, and I think we can't lose sight of that as we think about where we're headed as we hopefully emerge out of the pandemic and make sure that transparency, that constant communication is really embedded into our strategy as we think about how our benefit plan designs, how our programs, policies, how our cultural norms can really continue to evolve to support people where they're at.
Yeah, thank you very much. So the next question I have is, do you believe that benefits are a major driver of employee experience, hiring, and retention? And if so, can inclusive and equitable benefits contribute to these areas? Chris, why don't you start again?
Sure. Look, I think that they're absolutely a very meaningful part of the employee experience. And when I think about prospective hires, and in particular, I think when you think about your benefit programs, I think those are very emblematic and indicative. Those are like the signal lights, right? This is where and how much an employer chooses to invest finite dollars into supporting employees' health, their well-being, financial or otherwise, and work-life challenges. We actually debated a little bit around retention. I personally am not as convinced that benefits play as much of a role in retention, but I do think that it's going to be dependent on industry, dependent on employer type. So I think in certain cases, benefits can be much more meaningful to retaining employees. But I think in general, I kind of think about Maslow's hierarchy of need, and some employers and organizations are further along that sort of continuum. I think benefits might not be as important relative to that, and I think other things like career development and compensation and manager relationship can be more indicative of whether someone chooses to stay or go. But I think at the end of the day, it's incumbent upon all of us as employers to really continue to think about how do we continue to enhance our benefits, to really look at it through that diversity, equity, inclusion, and belonging lens. And I think about the journey that KKR has been on over the last 7 years. And we've been very deliberate in terms of our efforts to support our employees, especially around family building and support. And I don't want to talk on all the things that we do, but I think in particular, if you look at our partnership with Progeny, for example, we offer unlimited IVF. So there's no cycle limit, there's no dollar cap limit, unlimited egg freezing and sperm freezing. We give employees $50,000 against surrogacy costs, $20,000 against adoption. And I think we do that globally. And outside of the US, we partner with Carrot. The dollar amounts are a little bit different. But I think at the end of the day, what it's emblematic of is how we feel that we want to create less friction, right? We want to make it easier to access high quality care. And I think economics plays a big role in that. And I think when I just hone in on the surrogacy and adoption in particular, if you're an employee and you're having a child under the healthcare plan, 70 to 80% of your costs are probably covered out of, in terms of what the firm is spending versus what you're spending. And I think when we think about those dollar amounts within surrogacy and adoption, We're trying to get to that 70 and 80%, right? We're, from a proportionality perspective, we know that that's how you create something that's more equitable. And look, not all employers can financially absorb that necessarily, so I'm not saying that it's perfect, but yeah, we asked for even a greater increase against our surrogacy and adoption, and those things were just approved, so can't share it with you quite yet. I need to tell my employees first, but we expect with this open enrollment that they're going to get even beyond 50 and 20 for surrogacy and adoption, respectively. So we're really looking forward to continuing this journey and thinking about how else we can be more equitable around some of the things that we do.
Thank you. Ian, maybe you can tack on to that question. Do you believe that benefits can help drive inclusivity and equity?
Yeah, no, I absolutely believe that they can do that. And I, just listening to Sarah and Chris both in the last set of comments that they made, I think we have to kind of roll the clock back a little bit, or just remind ourselves what's just taken place in the last 2 years. To ask those questions and to kind of evaluate, how important are the benefits? How important am I to my employer? How important is it that I'm in my workplace versus at home? I would say the entire equation for all of us has been, juggled or thrown up in the air, and we're kind of not sure where all the numerals are going to sit, right? When the equation is done, I think we're going to find some people that will say benefits are the most important thing, actually, for me, because I don't have diabetes, I don't have high blood pressure, I don't have, I'm not in my reproductive years, but I have like a teenager or a college student that has a mental health issue, and I'm trying to help I'm trying to do my job, but also help that person keep their life in order. So I think we're going to see a lot of reevaluation and assessment of which different benefits we need at different times. And the way that I was trained as a clinician, I think first as a clinician, as a primary care clinician, and so I see a lot of things through that lens of like, well, this is what your diagnoses are, give me your problem list. I'm really good at picking the right medication, but and that's my job, I can do that part, but I need to work with someone like Chris or Sarah, Lindsay, to actually start to really think about all of this anew. And I think we need a new set of benefits, and thinking about these problems the way we did pre-COVID, I would just say, I want to encourage us to think outside the box. We're not going to do it here on this stage today and create something new, but I think we should really think about that and what that could look like, because there's no question the benefits have to get to people of color, and we need to be addressing other marginalized groups, members of the LGBTQ plus community. I think we're just going to have to do more work there, and we are very much at the very beginning of that journey.
Yeah, I think that's a critical point, thinking about creating benefit plans that are inclusive of all groups. And really, we have likely developed these plans based off of the majority and not necessarily the minority. And so I think as we look forward, thinking about diversity, equity, and inclusion, understanding some of those nuanced situations of employees that come from diverse backgrounds will be critical. So my next question, and Lindsay, I'd like you to take this one first. So we currently have 5 generations in the workforce, which certainly has its implications for employee benefit requirements. What are some of the difference in benefits necessary for a multi-generational workforce?
Well, I love this question. Thanks for asking it, Duane. And I want to address actually the retention question as part of this. I think you can't ignore the fact that the workforce has lost 3 million women in the last year. 3 million women. Like, this should be on everybody's mind. And when you think about why women stepped out of the workforce, it's one of the major reasons we're hearing is caregiving. Children in the home, children with chronic conditions or disabilities, parents who are aging and need more care. Women especially take on the role of caregiver, and they're just getting squeezed. And we have no child care infrastructure in our country. We have no elder care infrastructure in our country. And so women take on the role. I think the stat, when we opened up health, the stat that was shown was 1/3 of employees who stepped out of the workforce were unpaid caregivers. And so I would push back on your comment, if you don't mind, Chris, that I think benefits can play a massive role. And in part, I feel badly for you and Sarah, because you all have this frontline worker responsibility to help employees like me be able to stay in the workforce. But be able to also manage my 4 kids, my mother-in-law who's in a hospital right now, my grandfather who just passed away, like without additional support, I don't know what I would have done. So anyway, I think it's a problem. I mean, we support families who are living in multi-generational households with parents and grandparents, and this is a bigger issue for lower income families to navigate how do you put food on the table, but also afford medications, deal with kids when they come home from school and make sure they're supported. It's really challenging for workers right now. So I mean, we have the answer at Wealthy. We support families with this exact topic, but it scares me to think that employers aren't tuning into this topic of retaining women and retaining caregivers.
Yeah, exactly to the point of thinking about diverse audiences. And Sarah, I'd love to hear from you on this question as a Chief People Officer.
Sure, and I love having a front row seat, by the way, to our employees, because I think about benefits as it's a big engagement driver, and it gets to the culture that you're looking to build as an organization where, you're listening to, you're connected to the individual needs of folks. And when it gets to generations, I find it fascinating. So we have 5 generations in the workplace. We happen to be a 62-year-old company. When I got there about 4 years ago, I joke that average tenure was like 35 years. I had an employee, she actually reported to me, she celebrated 48 years of working there.
Wow.
And so, lots of, long tenure. But I get really simple and think about the difference between my 3 adult children, 19, 22, and 25, who wouldn't open an envelope to save their life. The Amazon guy coming down the street, dropping off a box, yep, box cutter ready to rock and roll. But an envelope that might have their, benefit card or anything like that, no clue. And they want care right now. They're not tied to a particular provider. They're not tied, they don't understand waiting. They just want to get on an app, get to the dentist or get to their doctor and meet their need. And I compare that to when I was a caregiver for my father, 30-year military veteran, diagnosed with cancer, living in our home, very compliant mindset, right? Wanted to know where his card was. Does his primary care physician know? What do you mean we're going to go get a second opinion at this other place? Like, I don't understand. So as an employer, I think of those 2 audiences, Gen Z and millennials making up, 50% of the workforce or more. 68% of my population is female. I've worked in healthcare for a long time, and it's, many of us have female-dominated workforces, right? So I think what's really incredible is just expanding the thinking of benefits beyond benefits kind of in their box of, it's your medical, it's your dental, it's your vision, and really thinking about all the other things we can add into that maybe we weren't thinking of. So, and designing it in such a way that you can be flexible. We started recruiting a younger workforce who wanted to make sure that we had a fertility benefit. So made sure we had a fertility benefit so that we could attract individuals to come work for a 62-year-old, dental insurance organization. We have folks who have fallen into the, care provider role, right? Like many of you, we started immediately remote working our 4,000 individuals. And there's this really funny thing that happens. You think because you're working at home, you can also provide care to people who are at home, and you can also teach at home. And so we really quickly learned through, again, just those dialogue channels, with our employees that they needed support for that. So we started to expand our benefit offerings and looked for ways to connect our employees to services that could help them find online tutoring, services that could help them find, nanny care, pet care, care for parents in the home. And I think that, I'll be a broken record this afternoon, but it's really about that beautiful front seat to your employees that invites that dialogue and invites those individual perspectives so that we can, learn, listen, and appreciate, what does it mean for my female population in Alpharetta, Georgia, that is different than, my population in Rancho Cordova, California, and how do we build something flexible and help improve that access so that we can help people navigate, I think to your point, navigate a healthcare system that may not have been designed for them.
I just want to jump in because I love that you all were doing that work. That's a good example of the kind of work that we might say in our traditional system, well, when you get to the doctor's office, they will take care of all that. They'll help you to connect remotely to, for your doctor visit, but the reality is that no one is actually setting up in the payment reimbursement structure for the doctor or the doctor's office to actually be able to do that. So it's very challenging. I don't know if that's the most scalable answer, but it's like, but this is the kind of thing that I would say we need to partner on more so that your associates or employees have some understanding of how to connect, that they know what's available to them. And I think awareness of what they have access to is probably one of the biggest things that I've seen. And then there's a behavior change piece of this that has to take place. And we've been forced into that behavior change this year, but I think we can encourage and make it more of a, it doesn't always have to be forced. It can actually be a benefit and a different way for people to see that benefit as beneficial and more efficient, right? More cost-effective, more fun. People don't often hear that word associated with healthcare delivery, but I think it could be that way.
Yeah.
Great, excellent. I also want to remind the audience, if you'd like to submit your questions, and I'll be happy to answer or ask your questions to the panelists today. So my next question, actually, Ian, is going to be addressed to you first. Access to care is a major issue that contributes to health inequity.
Yeah.
So how can we leverage technology to improve access to providers and healthcare services across the country?
Yeah, everyone can probably predict my answer to this one because I've been doing this for the last 8 years. 8 years ago, I was a brick and mortar practice primary care doctor. I was an educator at Stanford, so I was going back and forth between the VA healthcare system and Stanford teaching my students, and I let my patients come to me. And so I took great care of my patients, but they kind of had to make it there and get into my office, and they had to fight the parking. And it was when I started my program for homeless veterans that I realized that I kind of needed to take the care to them, to where they were. Then I got introduced to telemedicine, and I saw how a vertically integrated healthcare system was using technology to reduce costs, improve access, provide equitable care, more equitable care. In that model, it was more about delivering subspecialty care to rural areas where veterans didn't have access to oncologists, right? It doesn't make sense for our system to place too many oncologists in a rural setting. They're going to be in metropolitan settings, and so therefore the patients, again, all come to you through that funnel. But with the early experience with virtual care, and this is the reason I ended up joining Doctor on Demand, it's included health as of today, was because I saw that platform could actually be an equity platform. And the word's probably overused today because I think everybody's talking about it, but I really do feel that it offers patients the opportunity, or members or associates or employees, the opportunity to access care the way they typically naturally do it, which is organically you have a problem and you put it off and you don't do anything about it, and then you have to be seen, and then you end up deciding whether it's a crisis, an emergency, so you end up in the ER or urgent care, or you might have another option, right? And the other option could be virtual access to a board-certified clinician or nurse practitioner who is supported by a care team behind them, and that can actually begin the triage level, hopefully resolve the question, and we do that about 92% of the time. We're able to resolve the care so that patient does not have to go anywhere else within 92% of the time. Within 14 days, they are not seen in any other setting. And so it's an equity platform for that. I always think about the single mother or a father who has 2 jobs that are hourly, and they really can't, between 9 and 5, during my normal hours of clinic operation, they could not see me. But with a virtual offering, you can offer 24/7 care from the member's home or the patient's home. You can actually also offer them a diverse group of clinicians with multi-state licensure across a region of the country. So now you're talking about standardizing care across multiple states or a region with the same clinicians that you have trained up to a certain level of quality. And so it's an equity platform from that standpoint, but also I would say for the clinicians, 1 in 4 of our clinicians are actually a caregiver for someone in their home other than a child. So we have doctors, nurses, and so on who are taking care of someone else in their home and can still be professionals, practice their profession, offer access to care, but also take care of those other family or community responsibilities.
Yeah. Thanks for that answer. As I think about the health equity perspective on this, I know that technology can play a great role in advancing equity, but it also can lead to some challenges. So when we think about access in remote areas where internet service is not great, that can be a barrier that further exacerbates rural health inequities. So the next question that I have.
You want me to address that?
Yeah, please.
Well, you can't say that and let me not chime in and say,
Absolutely.
It's very true, and so that's why you offer multiple modalities through your platform. So chat, phone. There's nothing wrong with being able to talk to a clinician on the phone, and I've practiced a lot of phone medicine in my day. But one of the things that we saw that was interesting in early COVID was when we looked at the zip codes that patients are connecting from. During early COVID, we actually saw an increase of those patients coming from low-income zip codes. So household income less than $20,000 a year. So when the care was needed most, and the adoption was highest, we actually saw a broader base of individuals using the service. Over 53% of our patients were coming from these low-income zip codes. The good news is there, though, because you might say, well, that's just the COVID effect. The good news is prior to COVID, it was already 43% of those patients. So almost half of the patients are coming from these low-income zip codes anyway.
That's great. Great. Anybody else want to contribute? Okay. So next question here. By the year 2030, all baby boomers will be age 65 or older, according to the U.S. Census Bureau. So this demographic shift actually means that the need for caregiver services will increase. So how should we address this issue, and does the responsibility of caregiving have a disproportionate impact on any one group? And I think we've heard a little bit about that. Lindsay, I'd like for you to answer this question.
Yeah, no, I think it's something that unfortunately will fall on employers. We don't have enough, you think about the history of benefits, providing health insurance, providing access to retirement savings. Those are in a sense sort of social nets, for employees who need that type of support. Just with the shifting demographic trends, we're going to see, and we've already started to see this, more and more employees who are taking care of loved ones with complex chronic and ongoing care needs, aging-related issues, and it's enormous. I think it's 2/3 of people on Medicare have more than 2 chronic conditions. Some crazy number, like 1/4 of Medicare members have 6 or more chronic conditions. And with increasing complexity in conditions comes increasing complexity in care needs. And so the result is employees are spending a tremendous amount of their time navigating the system, trying to find providers, second opinions, trying to get bills covered and appeal a discharge, trying to debate whether to keep mom in their home and move mom into your home or find an appropriate living facility. Those are very complicated conversations to have among family members and really difficult decisions to make, not to mention incredibly expensive. And so, we're going to see this hits all pillars when you think about physical well-being, emotional well-being, financial well-being of employees. This aging boomer population hits all of those concerns for employees and therefore for employers. I think we're going to see more employees have to step out of the workforce because they're taking care of more than one family member who's dealing with issues. So unfortunately, I think it will fall increasingly on employers to support employees with this topic and with this need.
Mm-hmm. What's the hashtag? Thanks, boomers.
And I'll give one other shout out, which is the other part of this, as we talk about inclusive benefits, is trying to create more age, embracing work environments. So we're, as we think about having more diverse workforces, We're creating roles and opportunities for older workers who still want to stay engaged in the workforce, and being very mindful about recruiting those individuals and then how you set them up for success with benefits. And I don't hear that topic getting talked about enough, but if we can keep older workers in the workforce engaged, passionate about what they're doing, that keeps people vibrant and healthy, their mind active, and benefits society by having, you know, a bigger talent pool to pull from. So anyway, final comment there.
If I can just jump in there, not only that, but they are the treasure trove of an organization sometimes. If you have these long tenured folks who, you know, have been with your organization like 48 years or 35 years or whatever, they can be such critical players at the table in all the transformation we're seeking to drive, right? Because they'll know, well, how have we done this for, 40 years, or, what does that process look like? So just to add on, they're the population you also don't want to lose in an unpredictable way, right? Because you're probably churning talent kind of in that, 1 to 3 years, depending on, what your organization is like, and partnering those folks through really setting up the organization to work on teams and to, have the nearly retired folks connected with some of the folks who are low tenured, a year, 2 years, 3 years in the organization, can mean all the difference in driving incredible transformation. So I just wanted to agree that you want to not just let them, go without being really thoughtful.
And I'll just add one thing. I think flexibility continues to be sort of the word in terms of where I think people are just looking for more support from their employers. And I think one of the policies that we put in place during COVID, just in recognition of the fact, and just in recognition of some of the continued changing needs of our employee base, is the fact that we have a family caregiving policy where, regardless of whether or not it's your grandparent, your spouse, your child, a sibling, if they have a critical illness or injury, we're giving people 4 weeks off at 100% pay globally just to take care of them. Because we reckon, and look, a lot of it was born out of the COVID sort of concern, but it's just irrespective of whether it's COVID or not, I think this recognition that people have lives that are outside of what they do for work, and they need to be supported through those things. And again, 4 weeks is a very finite period of time, so it doesn't solve for all the challenges that someone's going to deal with, but I think these are just examples of things that employers can continue to focus on in terms of trying to support their employee base.
Yeah, thank you, appreciate that. So I want to talk about one last issue here as we conclude our session. Maternal health and its associated disparities really are a major issue in the United States, particularly for Black women. According to the Commonwealth Fund, the maternal death ratio for Black women is 2.5 times the ratio for white women and 3 times the ratio for Hispanic women. So how should employers be thinking about changes in benefits design to address this particular issue?
Yeah, I'm happy to go first on this one. I mean, I've seen different statistics, 2.5, 3.5, even 4x the mortality rate. This is something that it's a hard one for me because it's embarrassing, honestly. As I feel it as a doctor, I feel it as a professional, but also as a Black physician as well. I think there's a lot of things that this stems from. Number one probably is unconscious bias. You have a lot of well-meaning doctors that have that don't maybe realize, right? It's unconscious, that's part of the title of it. Like, they just don't realize that they may not be allowing their patients to come to them and meeting them with cultural humility and allowing their patient to feel welcomed in that office. And so I think we have to address that. Like that up front has to be a thing that can't happen. The first 120 seconds of any medical visit, every Black woman should feel the exact same as every white woman that goes into that office and is getting that and having that visit. They should feel like they belong there, that they're welcome there, and they should feel comfortable sharing the concerns that they have and that they won't have to over-explain themselves. And so some ways that you can do this are helping to make sure that you have a rich pipeline of physicians that want to practice in that community. So culturally concordant care is a super important thing. That's something I've been working on for most of my career since I, right as soon as I entered medical school, I was trying to figure out how other people like me were going to be able to get into medical school. I think this is a really important thing. We've worked on this in our practice. We have about 50% of our practice are Black, Indigenous people of color. We are going through unconscious bias training. We've already done that training, but we're going through more because we think we can actually provide an outstanding experience for members of the Black community that's really unique to them, that acknowledges not just all of the core competencies of maternal fetal health, but also that family may play a much larger or very important role in the infrastructure of that household. And so, and I should say, when I say family, I mean extended family, not just a two-parent household, but there may be others, there may be grandmothers and so on that are involved in the equation. And they need to be brought into onto the care team, if you will, to make sure that their care is comprehensive and appropriate. And then we also have to make sure that we're, again, partnering with members of the community, whether those are social workers or healthcare workers in the community that are opening the doors appropriately for those individuals. So what does that mean? That means we might need to talk to them after church, at the church social. We may have to be in the barbershop. We have to go to places where these patients are to provide the right level of education for them. And then, then I think we need to welcome them to using technology in the same way that everyone else does. And so again, there's an education component to that for sure, not just for Black community, but I think for all of us, seniors, veterans, and so on. But we have a lot of outcomes, clinical outcomes in the Black community to show that this is a moral imperative. It's of highest urgency.
Yeah. I also think there's a role for benefit plan design that perhaps covers doulas or other advocates that can walk alongside Black women as they go through the process to really help them combat any perceived unconscious bias or racism that they might face. Any other thoughts?
Go ahead.
I was going to say, Duane, I love that notion. I think that's where benefits are going to go, is that it's benefits and health and care are so intersectional. It's not enough to just service a pregnant woman. You have to service a pregnant woman understanding religion, culture, race. And we see this in our business every day, where the matching of the family, the employee and their family, to the right care providers is so critical for everything, for trust, for outcomes, for, comfort, whatever it is. We do that at Wealthy, which is really taking into account the intersectionality of caregivers, what might influence their kind of thinking and decisions, and how we can meet them where they are with a care professional who really understands where they're coming from. And I think that's where we're going to start to go with benefits, that kind of better matchmaking of the right employee with the right care provider.
I appreciate that intersectionality perspective, particularly as we think about Black birthing people. So beyond just cisgender women, trans Black women, trans women of color also suffer these types of issues, and it's further compounded by the blatant discrimination that they might face. Sarah, did you have something to add on that?
I did. I mean, echo everything that's been said, and I'll just maybe offer from an employer perspective. For us, 22% of our population identifies as Black or African American, and 68% are women. And kind of back to listening, a couple of things that we have heard from our communities that come together as employee groups and help us learn and appreciate what might be helpful is also working to not only make sure there's access, so are there providers in the community where they can seek care, feel welcome, all of those things, but also really I hate to say teaching, it's more, working with our employees to help them be that individual owner of, advocate for, of their healthcare. And, so that flexibility in large part is helping them, know what they have, know where those providers are, and be a voice. I love the idea of patient advocates, so someone who can, help them navigate that access. And in part, anything we can do as an employer to put those tools in front of them, equip them with their information, knowledge, and what their needs are, and help them articulate that, I think is really critically important too. So I just wanted to add that one extra piece to everything you all have said.
Thank you. Well, thank you to all of our panelists today, and thank you to our audience. I'd like to give you all a round of applause.
Likewise.
Thank you.